Hi, and welcome to Healthcare IT Today. I'm Colin Hung, and today I am joined by John Ellis, Director of Growth at ReferralMD. John, welcome to the program.
Thanks, Colin. Thanks for having me on. I appreciate it. Great to chat with you again.
Yeah, I'm excited to get together with you today because we're going to talk about something that, first of all, I'm not extremely familiar with, so I'm looking really forward to learning a lot more, but that is the whole referral process.
Be careful what you wish for. But yeah, I'm excited too.
Well, and maybe for the benefit of those like myself, can you give us like a quick 1-2 minute overview of how referrals really work and what we're going to be really talking about today?
Yeah, I think as we look at the referral process with, medical practices and specialty providers and even just patients, right, as a key stakeholder in this process, really specifically, we're talking about those medical referrals, right? So just a quick intro is you go to your primary care physician with some upset stomach, you're not feeling well, and you've had some, internal issues. They may not know what's fully going on, so they would recommend and refer you out to a gastroenterologist. And so that whole process of then how do you get into that specialty practice to get care delivered to you through that, a lot of that would flow through the actual what we would consider broadly, right, as the referral process, if you will.
So you and I were talking a little bit before we started the recording, and you were telling me that everyone involved in a referral, and that's like the patient, the referring physician, the recipient of the referral, they all hate the process. So can you maybe expand on that for us?
Yeah, I thought it was off the record, but yeah, I was, as we talk about that and the thing that I always hear, and no disrespect to the electronic health records, is that every practice I've talked to, no one likes their EHR, right? They just hate it to varying degrees, right? And again, no disrespect to them. It's a very difficult process to capture all this information, but it's very similar with the referral process. I mean, I've literally talked to a single provider, a primary care physician, a single provider dermatology practice, all the way up to, public health and hospital systems, right? Like everyone across the board, like hates the process, right? And if you think about it from the provider sending out the referral, a lot of times it's a black box and they don't know what happens. And many times if they're intimate and they're close to their patient base, they do genuinely want to know what happens with their patient, right? And hey, how are you doing, Colin? Is everything going fine? Has that been resolved for you? But then just economically, a lot of them, as we transition more into like value-based care arrangements and risk assessments and risk agreements as well, is that they're, for lack of a better term, like on the hook, right? So they really want to make sure that everything went through, and they don't know what happened. They're like, well, I have to deploy labor to figure out what happened to Colin. Where did he go and did he schedule? So they're unhappy with it. And from the specialty side, they're getting all these different referrals from different places with different portals or different fax lines and different levels of information. And some have more information, some have prior authorization, some don't. And they just wish, like, I wish I can get the same information for every referral. And then on the outside looking in, peeking through the window is the patient knowing like, well, I've still got these issues. I don't know who I was referred to. I haven't heard from the person. And it's, getting worse. And then, so I go back to the PCP or I mean, worst case scenario is I go to the ER, right? And that's really where, it really starts to fall apart. And so I think, out of the three key stakeholders there, no one's happy with it. They're just like almost different levels of like acceptance, if you will.
Yeah, you're touching on something that certainly I've personally experienced when I was referred to a specialist for something. It wasn't clear to me whether it was my responsibility to call the new doctor to make the appointment or whether they were going to call me.
Mm-hmm.
And so it's almost like dating. I was like, do I call first or like, am I supposed to wait? And
And I text, do I swipe left or right, or what do I do? And, you
exactly.
know, yeah, they look at it and they're like, they don't know what to do. And so a lot of times they will call back who they're familiar with. I mean, they're nervous to call a practice and, they don't know. And, and then, we're in a scenario where most people don't answer their cell phone anymore, especially if they don't know the number because, your extended warranty on your car is about to run out. And, every day I get those kinds of calls. So it's like, I just ignore every call at this point. And so they don't know, and they don't know that the specialty practice actually has called a couple times. And so then I call my primary care physician, and the primary care physician is like, well, let me call the practice. And they're like, well, we have called. And so it's just like, it's like who's on first,
Right.
right? And like what's going on. And again, this is progressively getting worse for the patient.
So I mean, it is 2021, right? And why is this process so broken? I mean, everyone, for the most part, has an electronic record now. We do have electronic ways to get information from one person to another, right? We all have cell phones. Like, but why is this so broken?
Well, I think that's an interesting point too, and I think we talked about this earlier as well. I mean, the question is like, is our system broken, or is it operating exactly how it's been designed to operate? And so I
Good
think
point.
that's like a material question there, because if you build a submarine and put a screen door as the hatch, and then you start taking on water, well, is it broken or is it doing exactly what it was going to do? You put a screen door on the thing, man. Like, what is happening here? So I think that's a fundamental thing, is like, is it really broken, or is it piecemeal to say, well, we want to do some window dressing and we want to make it easier? And you're right, with these electronic systems and the push for interoperability and fines for not being able to connect to one to each other. Um, I think there is a desire to have it fixed, but is there the stomach to fix it, right? Is there a stomach to do this and like push through it? And so yeah, it's really, unfortunately, the person that kind of bears this the most is that patient looking to get care, right? And not to get on my, you've already got me on my soapbox here 5 minutes into this, Colin, but like we look at this of like, they're the ones kind of out there of like, they're just trying to get care, and these walls and barriers have been put up in front of them. And so yeah, that's kind of a core philosophy as I look back, like, well, is it broken? Yes. I mean, I think so, but like, it's also like, it's working as it was like materially designed to work. And so I think it's like, how do we look at that, and how do we, make it more effective to be able to transmit information without looking at it as like a competitive advantage? And if, I think the one thing when we talk about, everyone's got electronic health records and everyone has these systems, like, why can't we make it easier? And I really look at it as, it comes down to like the systems and the processes and that conduit that we put in between those two systems, right? And I think the analogy when I'm talking to medical practices is that um, things, we got to get away from things being very, very app based, right? Like the thing that I realize is like, if you take iPhone, for example, like an iPhone and iMessage, like texting each other is an incredibly elegant solution, right? It's very, very elegant. However, the second you put one Android user into that group chat, nothing works for anyone. And now this is coming from like a decade-long Android user who I was the green one and turned everyone green. And I had to convert now this year with my oldest daughters getting iPhones and wanting to FaceTime. So it's like, it was kind of forced conversion there. But you look at that of like, well, the referral management is kind of that same note of like, well, I'm sure Epic would love this, but if everyone just used Epic, just like everyone was like, here's Epic, I don't know, maybe that might kind of resolve some of these things. And so I think that's what you're getting to, is you're having these people that are their economics are not aligned to quote unquote fix it, because they're like, well, hey, it's better for us if everyone uses the same system. So let's make it clunky to where it doesn't work. And so again, for the consumer and for the patient and the person, they're the ones most affected by it, I think.
Well, you hit on something there that I believe, which is that for years there was no clear owner of the referral process. Like there wasn't
Mm-hmm.
somebody who would say, "Oh, it is my responsibility to make this right?" Because part of it lied with the patient, part of it was with the referring physician, part of it's with the specialist on the receiving end. And so it's sort of like the hot potato. Nobody wants it.
Yeah,
And
yeah,
so
yeah.
no one did too much to really fix it or invest in it. But I think that's changing a little bit now as, now we're getting into more focus on patient experience, referral, people are joining networks to make sure that the revenue is captured within network and that kind of thing. So there's seems to be more incentive to actually get around to fixing this problem.
I think so, and I hope so. I think that's the way that we're trending, right? I think as we look at consumer experience across our everyday life, how much of a focus that has come into, even going back 10 years, but even more. I really look at it as, 2007 was like pre-iPhone, right? And so it's like, that's like the line in the sand of like that consumer engagement, that consumer focus. And you look at things like our cars, our smartphones are an easy one, right? But our computers and, and how are we putting the customer centric and customer focus and customer first? And unfortunately, I think you have to call out that like healthcare was really removed from that, to say, well, we don't want to look at them as customers. And certainly to an extent, right? If you look at a patient as a customer, that's a negative connotation, as it should in many, many cases, right? You don't want to look at them as dollar signs. But inversely, they didn't look at it like, well, no, they're consumers and they're customers, so we need to treat them and engage them as such, right? Like all these other businesses were like, no, these are customers. They have choices. They have options. We need to compel them through technology, ease of use, engagement to make sure they come to us. And unfortunately, I've been in healthcare now for several years. You start to see where it didn't have that same arc. It didn't have that where they're like, no, they have to come to us. We're contracted with their payer. They have to do it. They need us. I think that's starting to change. I don't know about you, but I do feel like, there's really starting to be that shift of like, well, no, they have options now. The consumers becoming more and more educated. And so now we don't want to just take that hot potato and throw it over the fence. Right? And say, hey, Colin, I don't know what's going on with you. To be honest with you, go talk to this guy. And then you're like, what's going on? I do think there is now that push to be like, well, how can we make it better engaging and a more engaging process by looking at them as a customer through that lens, right? Of that, like, hey, they've got choices. They have a higher expectation. Now, customers are not naive, right? To an extent that they were maybe, 2 decades ago, right? You don't know how things work. And so I think there's been that push. And I think even as we look at like the direct pay space and what people are doing like with direct primary care, big shout out to Hint with Zach and what he's doing over there and really pushing that, I think has been awesome. And it's kind of getting people more of like, it's okay to look at you in a consumer in that sense, like in that sense of like, hey, we want to like reward you and we want to like incentivize you to work with us. And we're going to incentivize you through great customer service, right? And usability.
So I think it's pretty clear how a broken referral or an inefficient, let's call it, referral process can impact a patient. I think we've all been there. We've all had or heard stories of that. But for the two providers, maybe can you walk me through what some of the downstream impacts on them might be of an inefficient process that maybe they don't even realize, can happen when they're not putting a focus here?
Yeah, absolutely. I think let's look at it from the originating provider, right? So it's the primary care physician. And so depending on where you're at and what kind of provider are, maybe you own and operate your own primary care practice, or maybe you're part of a large health system, right? There could be materially different on how they're impacted with it. But even on that smaller side, if you're looking at that, well, again, you've got to look at them as a customer in that sense, right? Like how can you resolve their issue and really help them? And so if you're not kind of owning that referral process and helping them through it, if that referral falls through, and let's say they don't ever connect with the gastro practice and their issues get worse, or even maybe they get worse, but then they get better, meaning they don't need to be hospitalized or it's never like terminal issue or anything like that, who do you think that patient is going to look at that impacted their progress? Do you think they're going to look at the gastro who they have literally never spoken to, they've literally never been to, or are they going to look at you and be like, hey, Dr. Colin, you didn't help me? Right. And so when you look at that, again, they may have more choices now and they may have more options to where they may just change their primary care physician. So you could potentially in that scenario just lose a patient as a customer, right? And lose them of like in that sense, which again could be just have a negative impact on your panel and understand that. I think the really scary downside of that is like, what if it is something that's terminal or something that does progress rapidly? Maybe it is, right? Maybe it could be something that is like very terminal that needs to be issued and you don't lose them as a customer, you lose them as a patient and they had to be hospitalized and things that, escalated. I think there's a real impact there that could happen. And so I think that's a very real scenario, right? What does that look like and what happens there? And so I think whether or not how your payer arrangements are built, shared savings and things of that nature, there could be some economic alignment there. But again, as just looking at them as like, this is someone in your panel that you want to treat and make sure that they're healthy, like how are you impacting that? From the gastro practice or just broadly the specialty practice, I just keep using them as a reference, but just generically, on the specialty side, again, it's about how are you engaging with your referral network and your referral providers and how are you with them in the community? Are you putting gates to them to be able to get your referrals? Like, do you have these 9 boxes that need to be checked? And if they're not checked, then you're not going to pick it up, right? Or what's going to happen there? And so what's that relationship like? Because again, similar to the patient having options, this provider may have options to send them to other people as well. And there are some really well-oiled specialty practices that do very well in their community. And honestly, a lot of it just comes down to relationship management. Like they're out there with the patients, but they're out there with the providers. They're doing lunch and learns. They're meeting with them. They're giving them updates. They're giving them proactive reports. They're giving them analytics. They're letting them understand that, okay, when you send a referral over here, it's not a black box, right? We can show you every step of the way what happened, and I can tell you just from experience that those referring providers hold that in very high regard, right? And so where are they going? So I think on either side, it can be a big impact, right? If you're not managing it correctly.
Yeah, it's a great point that you bring up on the receiving side. I mean, if you make it difficult to if you make yourself difficult to work with, sooner or later, the referring provider is just going to go, you know what? I'm not going to send my patients over there. It's too difficult, too much work for
Yes.
me to get that appointment made for my patient. I'll find someone else.
Yeah, because there's always someone else willing to take that, right? You
Absolutely.
make it you make it to where you're like, I need these 18 documents, I need all this filled out, and you're like, okay, I could do the same. Like this person just asked me to call them, right? Or again, like how are you? And I think even going back several years to where online scheduling for patients again is not to thinking of that consumer mind frame of like, you couldn't request an appointment with your physician, right? Like, I mean, you could buy a car online now, but God forbid you go get your annual checkup scheduled right online. I mean, you could nearly buy a house online at this point, right? But again, getting an appointment seems to be a barrier. But again, looking at that of like they wanted to gate it. And I would talk to practices, many years ago when I was doing patient engagement software solution, they'd be like, no, I don't want to make it easier for the patients because I just don't trust that they're going to book the right appointment or they're going to do this. And you're like, like you expect people to now call you and wait on hold and go through a phone tree with like 9 different options and request an appointment is number 9, by the way. So it's like you don't even make it the first option. And so you get to this point where, again, they're looking at that of this gate and this wall. And so same thing with referring physicians. You put that wall really high, someone else is going to find somewhere else to go and somewhere else to do it.
So if I'm listening to this conversation and I'm seeing the signs of an inefficient referral process in my own practice, um, what can I do to fix it? Like what are some concrete things I can do?
I mean, certainly purchasing a referral management software might be helpful, but I think there's also some steps that you can do, just immediately, right? Because you want to do your due diligence and make sure like which program is best for you and which best fits your needs. Engagement is a big part of it. Proactive engagement. I think you think of it like a relationship, right? Think of it like with your significant other. It's like you can go to that significant other and say, well, just tell me what you want me to do. Like if you want me to do the dishes, just do the dishes. Oh, okay, that's pretty minimal lift. But it's about, can you do the dishes without them prompting you to do it? Like that's what the significant other really wants. Like they want you to do it without being prompted to do so. And so think of your referral network as a relationship in that point. Are you providing updates to them? And so what's helpful, so if you're a specialty practice receiving referrals, what's very helpful is to do proactive response back to the referring provider. It's a simple fax back or a simple update, a simple note says, hey, we received your referral, here's the step. And then update them along the way. Give them updates because the more that you make them wait, right, to have to call you, again, it's like they're telling you, like, can you do the dishes? Right? Like, what do you do? It's much better if you just do them yourself and then show that you have that aptitude. And then I think if you're on the sending side, it's about engaging and talking to referral providers in your area. And so I think with them, it's the different side of that same coin is reaching out to them and say, hey, when I send you over referrals, do you have a preferred method? Like, is there a way to do it? Because, you can go to them and you get upset that you're not getting, real-time status updates. You don't understand the analytic. You don't understand like where they're going. But are you trying to engage with them as well? So it goes both ways, right? It's a two-way street. So are you engaging with them? Like, are you doing them? And so what I've seen just in my experience talking to thousands of practices at this point is it's really about those updates is like the minimum price of entry. Like they just want to know, like if I send a referral over to you, like I just want to know that you got it and know that you're working them. I hear so many times the frustration that the sending provider is like, I don't even know if they call them. Like, I don't know what their process is over there. And so what I would encourage them to do is, again, this could be an easy lift for you, is like call those referral partners, then ask them, hey, can would love to understand your steps that you go through once I send a referral. And then proactively share that, because I think you start to get that tension point, and those people are like, I'm frustrated because you don't send me the right stuff, and well, I'm frustrated because you don't ever tell me anything that happens, and you're just sitting there like pointing fingers, and it's not a great relationship, right? Not symbiotic, if you will.
I really like that. It's something so simple, right? Just sit down with people you're referring your patients to and get to know how their internal process works, and then make sure that you're very clear on what you need from that to say, I would like an update when my patient actually
Yep.
makes the appointment. Like just send me a quick note via email or fax or whatever the mechanism you want.
Yeah.
And therefore that way I won't bug you.
Yeah. Exactly. Yeah.
Right.
It
And
sounds
vice
too
and
simple to be
vice
true, right?
exactly. And then the other way around, like, hey, like, when you send your patients over, can you make sure you include these pieces of information in this format? Because otherwise it takes me 2 extra days to type it or rekey it or wait for the person to come in to do that, right? Like,
Yeah.
so you can save so much time if you just did this, which may not be actually a lot of work for the originating physician, right? Or the originating practice. So I love it, how
Yeah.
simple that can be. Just have a conversation.
Yeah. And I think, again, where those referral management solutions like ours come into play is that at volume, that becomes a difficult task. So that, I think that's where it fits in, is, again, assess what's right for you, like where are you at, but that's where you look at, like, at volume, can you have a tool that will help do that for you automatically?
So let's talk about that a little bit. Is there sort of a magic point where, looking at a solution like what Referral MD offers makes sense? Like,
Yeah, I mean, I think it does. I mean, I've even just today talked to two different practices. One is a very large, FQHC that at volume, I think its solution like ours, and all humility, is critical, right? Like, you just cannot manage this stuff on your own. But the other end of that coin is, a single provider, maybe a two provider practice that is doing a handful of referral volume. Certainly, if you wanted to purchase our solution, we would welcome you as a customer, but it may or may not always be the right fit. And so what I typically look at, I don't think there's a clear demarcation line of like the number of referrals that you're doing. And again, that's either sending or receiving, right? Either side. But there's a number there. And so what that number typically breaks down to is like, what number is that in which you need to hire another staff to like do the same task, right? There's kind of always that tipping point. Now, whether that number is 20 referrals a week or 50 referrals a week or 100, there's that level where the current staff that you have isn't able to manage it. So you would need to hire an additional staff. And that's where a tool like our solution comes into play, because it allows you to lengthen that number, right? Because now that one person could handle 2, 3, or 4 more of the volume before you need to add an additional staff. And because then otherwise it doesn't scale, right? Your growth rate in your patient panel is growing at the same rate as your staff. And so it's like you're seeing this incremental cost increase as well. And so I feel like that's where our solution tends to provide the biggest lift and the most value for those types of practices that are in that area.
I would I would guess that coming out of the pandemic as we are, that focus on staff is pretty high because people have become very lean during
Yep,
these times, and so there, this is a great way where you don't have to add the people back to do the referrals that hopefully are now going to be coming back to you to handle it
exactly. Yeah.
if you use a system like this.
Yeah, a lot of those conversations have been happening this year, but then even also is that some of the staff, at least early on, not as much now as we're coming out of it, but especially early on where they went remote, now you're really challenging to like, well, what do I do? I had the fax machine at the office, and
Mm.
now I've got to, yeah, okay, I convert it to an e-fax, and so that was a big barrier. So having a cloud-based system that can manage this even remotely, definitely there's a lift there, and having that. But yeah, you're absolutely. It's all about efficiencies, right? And especially with these independent practices, like the overhead is high, right? And there's a lot of barriers put in front of you, which is why you see a lot of consolidation. And so allowing them a tool to help them like maintain their independence and maintain their profitability at scale is key.
So we've covered a lot of ground here today, John. Is there one thing you want the audience to kind of take away from our conversation today?
I mean, selfishly, maybe a conversation with us offline, but yeah, I mean, other than that, I would say it's all about engagement. I mean, and not to be, tongue in cheek about it, but many of the things can be solved with just communication, right? Like, I want you to just think about, the frustrations that you have with potentially your referral network. And when is the last time you reached out to them when you didn't explicitly need something? So think about that. Like, when is the last time you just proactively called them to introduce yourself. Maybe they've had new staff members come on, which is why things have changed. And so just really understanding like the engagement with your referral network is critical. And just like any other relationship, it's almost silly how many things can be solved by just communicating, right? And communicating and saying something back to them. And it'll go a long way. So again, you can review systems and whether or not things are a right fit for you and what they can do for you. But also step one is like, make a proactive phone call, send a proactive email, other than like, I need this update or I need this document. Talk to them, learn about them. And I think it'll go a long way in just smoothing out relationships and making the process, just that much easier.
Final question, John. Where can people find out more information about ReferralMD?
Yeah, I think our website's the best, right? It is getreferralmd.com. So getreferralmd.com. We've got a lot of great content and some great videos on there, including our blog. And then feel free to reach out if they want any more additional information in there.
Perfect. Well, John, really appreciate your time today and all the knowledge you shared. Thank you for being on the program.
I appreciate it. Thanks for having me, Colin.
This has been Colin Hung with Healthcare IT Today. Have a great day.